are taking this beautiful face and just buffing and shining, making her beautiful eyes pop even more. We're doing a little upper eyelid blepharoplasty and putting a little laser to her lower eyelids. And patient's awake. She's comfortable. She's relaxed. I put on some John Cougar Mellencamp to represent my Middle America hat obsession today. A patient got me this awesome hat. I thought it was appropriate that we wear it today. We can check back in a little bit and see the progress. So you can see quite nicely. Let's just the difference after the left upper eyelid has been done versus the right. I'm just covering the patient's face with a cloth just to maintain some anonymity. And we'll come back and we'll take a look after the right side's done and see how it looks. And just see now, you'll see the result after both sides have been done. And if you'll just open your eyes for a second, you can see she's awake. All right. Thank you, Emily. Got a metal eye shield in her eye just to protect her. So the first pass, we're just removing the epidermis, the outer skin layers. And the second pass, we're going to be removing the upper half of the dermis. I'm really seeing a lot of skin tightening. Slide back. The key here is to keep the tissues very dry. Since CO2 laser is absorbed by water, it also gives us great depth control, so we can be very meticulous. I can choose energy levels that allow me to have a lot of control in terms of the depth of injury. And results are always dictated by the depth of injury. You want to go deeply enough to get collagen stimulation, but not too deeply where you're going to have problems with healing. All right, let's pull it over. So with the next pass, I'm going to come a little lower so that we have two passes and then one pass feathering into the non-lasered area. So because we have local anesthetic in the area, it's puffed up a bit, so it may not show as much contracture as when we do it in the operating room without local, because they're asleep, of course. But let's watch. This is the second pass. I've debrided and removed all the dead skin that we lasered with the first pass. So I'm coming a little lower than my first pass. With a single pass of laser. You can slide back. So you can see the periphery has one layer of skin removed and this has two, so there's a transition. We'll just pull down. desiccated or dried extra dead skin here. So there's a long healing curve with CO2, but the results are awesome. The first week or so she's going to go through peeling, and then redness will fade slowly over a period of weeks to months, and the final result will be a much smoother, much tighter and matched upper and lower lid. So there you did great.